Do you remember at the beginning of the pandemic where you're thinking, now, how come that person or this group of people they're getting really sick, and this group of people over here, they don't seem to have anything going on, and they're not really doing anything different, and this group of people over here, they should just all be dying from this bad boy. And it didn't happen. I was just starting to kind of cover some of the homeless topics going on at the time, and I kept thinking, how is the homeless population, how are they not just being taken out? The coronavirus. Because, other segments of the population, obese people, we knew that was a thing, right? We knew that old people that, their systems are not what they used to be without the defense systems. How did the homeless population basically just wasn't impacted by this? How is that a thing? I still don't know. But LA homeless deaths spike due to overdoses, not COVID-19, a report shows. Drugs, they're taking homeless people down. Coronavirus, not as much. How can that be? Homeless encampment, homeless living in a tent, you don't have any ability to wash your hands consistently. Who knows where you're going to the bathroom? You've got all these different things. You're not eating consistently. You don't have the greatest of health. Oftentimes you're on a bunch of drugs, like this article says. And yet, homeless folks weren't taken out by the coronavirus in numbers enough to even warrant a single major news story, because I would have covered it here, and we haven't really had that. So that's what we're talking about. If you're new, welcome. My name is Sean Reynolds. I own a couple of real estate companies, and I read the news. So LA homeless deaths spike due to overdoses, not COVID-19. Nearly 2,000 homeless people died in LA County during the first year of the pandemic, an increase of 56% from the previous year, driven mainly by drug overdoses, authorities said. The findings released Friday in a report from the county's Department of Public Health showed that despite initial fears, the virus itself was not the main culprit in deaths among California's largest in the nation unhoused population. But it did cut people off from mental health and substance abuse treatment after services were drastically reduced to prevent the spread of the virus. So you would think the coronavirus being as conducive as it was from hopping from one person to the next, or that's what we were told. If you weren't, you needed to wash your hands every other second. You needed to not go out. You needed to isolate yourself. All things that the homeless population can't really do. And yet it didn't seem to take them out in drastic numbers. They didn't even seem to really get sick. Was it because they're living outside? They're living in a tent. They've got a lot of ventilation. Don't really know. And that was always one of those storylines. I'm like, okay, at some point in time, there's going to be a massive story about coronavirus, because we were told it was so deadly that it was taking everybody down, right? We just were. It was, this great thing to be feared, and you had to get vaxxed. What percentage of the homeless population has been vaccinated? It's low. I remember seeing that stat and just thinking, okay, and yet they are not dying in numbers from the coronavirus. So what's the dealio? So between April 1st, 2020 and March 31st, 2021, the county recorded 1,988 deaths of homeless people, up from 1,271 deaths the same period a year earlier. During both of those years, drug overdoses were the leading cause of death among homeless folks, but increased by 78% during the pandemic's first year. In the pre-pandemic year, the Department of Public Health reported 402 fatal overdoses. In the year after the outbreak, the number nearly doubled to 715, the report said. The report found that 179 homeless people died from COVID-19 during the pandemic's first year. 179. Not even 200. 179 homeless people died from COVID-19. Has anybody done a study on that relative to the percentage of the population that's being taken out? I would love to see those numbers. Is the homeless population, or do they have some sort of natural immunity because something's going on here. This doesn't add up. This doesn't make any sense. This has never made any sense to me. So much of the whole stuff that we were told about with coronavirus makes no sense. And this is one of those big storylines, because intuitively, homeless people should have just been dying left, right, and center, right? With everything else we were being told. They should have just been, it should have been just every other one of them, just gone, boom, done. And at the beginning of the pandemic, cities were told, hey, don't do homeless encampment sweeps, because that's going to affect the homeless population, because they don't have the ability to fend off naturally, this virus that's going around. And if you shift them around, you're going to be moving the coronavirus. So that was one of the big things that led to this explosion of homeless encampments, particularly here in Seattle and in Portland and in other cities, San Francisco. But cities that had allowed their homeless population to just kind of do willy-nilly whatever the F they want, those homeless populations exploded as far as the encampments goes, because we weren't doing any sweeps. And I think that segment of the population got kind of used to just doing their own thing, and they weren't going to get swept. And so they built big encampments, and they had a lot of folks. And now I was just reading an article about when Biden came to town. Biden was in town last week. Yes, he flew in on his big jet airplane, his Air Force One, and he had his flotilla of 22 oversized SUVs, however many SUVs it was, following him around to make sure. And he came into town with that entourage to talk about global warming and the environment. So there was that. Yeah, anyway. But before he came into town, the city, they did a little sweepy sweep on a couple of encampments that were a little bit close to the Westin Hotel, which is where he stayed in Seattle. He made a run down to Portland before he came here and stayed in Seattle. And then he went down to Auburn, which is down to the south, 30 miles, something like that. And he did a little talk there at just about something. You don't care. Who cares? Ridiculous. But I found it entertaining that he's, pretty concerned about the whole environment, and yet the way he rolls around, not so much. Not a small carbon footprint. Let's put it that way. I find that really ironic. So 179 homeless people dead. It just seems like a shockingly low number. And I remember reading news stories like in 2021, and I was looking at the figures from the homeless encampments as to why they didn't have greater levels of COVID infection. And nobody really seemed to have an answer. And yet people that were hunkering down inside their homes, never really going out, they seem to be getting it left and right as well. Just like the rest of the population, we're told anyway, right? So this whole thing to me, it just didn't ever make a lot of sense. Still doesn't make a lot of sense. Now, the folks that are passing away from overdoses, this makes absolute sense to me, because in 2019, we started to hear the beginnings of fentanyl. Okay, who's taking fentanyl? That's a really strong drug. And it wasn't they were taking fentanyl, they were using it in place of what the other active ingredients typically were in some of these pills, the fake opioids, the Percocet or whatever it is, and they're putting in the fentanyl as the active ingredient. And it's not an easy drug to kind of hammer down, and you might put a little bit too much in one of the little pills, give it to somebody, they smoke it, and boom, they're dead. That is literally what's going on. It shuts their body down. So in 2019, I think in 2018, I had heard of fentanyl by that point, but 2019, that was kind of the turning point for me as far as seeing and hearing about fentanyl on just about a daily basis and people overdosing from that. So now it has overtaken, a lot of other things causing death, as far as this is something people are dying from. And one of the things that I, immediately thought of when we did all these shutdowns is kids in school out monkeying around, goofing around, are going to be doing a bunch of crime and doing a bunch of drugs. Well, we know that's true. That's absolutely true. And then people trying to get sober during this. You can't go to your AA group, and guess what? It's pretty tough to do a legit check-in when you're, doing it via Zoom or whatever, especially if you're supposed to be in getting urinalysis or whatever. And so difficult for people trying to stay on the straight and narrow when, they've been off the rails and maybe smoking some of the crazy stuff that's out there. And so I immediately thought at the beginning when we had all these shutdowns, well, you might be saving a few people from the coronavirus, but on the back end of this, how badly is this impacting society if you do a shutdown like we're doing? And we did one full up tilt here in Washington State. Ridiculous. It was absolutely ridiculous. No need for that whatsoever. So many other states handled it correctly, which was, all right, get the folks out of the way that need the help the most vulnerable of the population. All right, allow them to figure out what's going to work best for them, given this threat. And then everybody else kind of go about your way and do your own thing as best you can, as safe as you can. But the whole shutdown of this business, you got to shut down, that business, you got to shut down. Oh, you're not essential. We just got to shut you down willy-nilly. And then kids doing school from home. I mean, we knew at the time the impacts of that were going to be, we were going to see those numbers forever. And that's what I thought maybe we'd see with the homeless. We'd eventually see, okay, up front, and while we were in it, we couldn't really see it. But now that the pandemic is mostly over, right? Although we're being told, oh, there's a new variant, and Shanghai is shutting stuff down, China is shutting stuff down because they have a zero tolerance. But here in the United States, I just noticed earlier today, one of our health whatever here in Washington was going to do a little talk about the new variant and its threat. But there is no talk about, shutting things down again by any means. But I really felt strongly that we were going to see some stats about the homeless and the impact of COVID on them. Shockingly, or not, depending on what you think, we haven't really seen that. In fact, drugs are taking out far more of them. Not shocking there, but you would, if I were to be a betting man, I would say, all right, homeless person dies. What do you think? They die of COVID or they die of drugs? I would have said, well, that's probably a 50-50. I don't really know. I'm just throwing something out there. Yeah, half of them die of drugs, half of them die of COVID. Because why wouldn't they? We're being told, the rest of the population is being impacted. So, a population that can't protect themselves the way we're being told, you got to have a clean mask on all the time. You got to wash your hands like every 15 seconds. And you got to do it for 30 seconds and then warm soap and, warm water or whatever. Just that whole ridiculous thing. And then after a while, there was no talk of washing your hands. It was just get vaccinated. And then, right? I mean, study of San Francisco homeless deaths released last month showed similar findings. Between March 2020 and March 2021, there were 331 homeless deaths recorded in San Francisco, more than twice the number of any previous year, with the leading cause of death being, yep, you got it, drug overdose. Not the coronavirus, drug overdose. Interesting. According to a study conducted by University of California, San Francisco, and the city's Department of Health. Los Angeles County is home to the Skid Row neighborhood. I talk about that a fair amount. Notorious for poverty and drugs, and where LA's homeless population was once largely confined. It's like they just quadrant off a neighborhood and put in kind of an invisible, dog fence around the outside and just said, homeless people, you stay here. That's what it looks like. When you look at a map and you just kind of look at footage of what's going on there, that's what it seems like. It's like, okay, you guys can't leave. You need to stay here. You want to do drugs? That's fine. You do them here, but you don't leave the confines of the neighborhood. That's what Skid Row looks like to me. Now, rows of tents, cardboard shelters, battered RVs, and makeshift plywood structures have familiar sights throughout the nation's second most populous city. Cities and states across the country are grappling with growing homelessness as well as mental health crises. California has the largest unhoused population in the country, estimated at 161,000, with nearly a quarter of that suffering from severe mental illness. Well, we dumped them all out of institutions. Where do you think they're going to go? They're going to go somewhere warm. LA's got a big population of them. Why wouldn't they go there? This makes absolute sense. And these stats are all according to a 2020 count of homeless people required by U.S. Department of Housing and Urban Development. That's called the PIT. The pandemic likely exacerbated an already growing drug and overdose problem, driven by the prevalence of fentanyl, authorities said. Meth was involved in the majority of deaths at 75%, roughly the same as the previous year, but the involvement of fentanyl in overdose deaths nearly doubled to 45%. So you've got this situation where fentanyl gets introduced and it gets a little bit of traction, and then boom, you start to hear about it. 2020, you start to hear about it more and more. And that's what we're saying here, is that drug overdoses are going sky high, percentage of that going sky high. Coronavirus, not so much. Not so much. And I find that really interesting. And I find the fact that not much has been said about this kind of tells you something, doesn't it? What does it tell you? I'm not really sure. But if the homeless population isn't impacted the way that you would think by the coronavirus, I mean, you've got the elderly, you've got the overweight, you got people with pre-existing conditions. They all get taken out, but not the homeless population, who doesn't typically have the healthiest, physical routine in life. You got some drugs, you have some bad eating, you got some sleep habits that are probably screwed up because of the drugs. You're not eating well, undernourishment. There's things facing the homeless population that other populations just don't really have to consider, like rodents roaming around in their food sources. I mean, you've got all kinds of crazy stuff going on. And police officers talk about this once a homeless encampment has been cleared out. They talk about the stuff that basically just gets released into the neighborhood. Rats are an enormous component of that, because when you have all that garbage, the rats got to go somewhere. And you'll see, I remember the Echo Park down in LA when they swept that area of 260 tents or something. You could see the rats that were underneath a lot of the tents had burrowed holes, and you could see their patterns, their traffic patterns. I mean, the rats got to go in and they got to eat their food and they got to walk around and, all that stuff. And they do that below ground. They do that. They burrow around and do their thing, and just gross. So you've got those kind of situations going on. And then you've got the rest of society all locked up at home, wondering when they can come out, wear that mask when they do. And yet you've got the homeless population living on the streets, interacting with other people, not as much as they once did, obviously, but still interacting with people as far as going out, getting some food, getting their services, whatever. And a lot of those things got really cut down during the pandemic. And people felt like the homeless would be, massively impacted as far as that went. When in fact, I think it was more of a progression of the fentanyl being introduced in as a drug and as a, it wasn't what people were expecting. They're not going out, hey, let me buy some fentanyl. Let me get an eighth of fentanyl. No, that's not what they're doing. They were buying other drugs that had fentanyl in it, and they didn't know it. And because it's so strong, they're overdosing. So crazy, right? Young Latino and Black people experiencing homelessness drove the increases in fatal overdoses, the report said. It's interesting. So people of color, you got your BIPOC community, homeless BIPOC community is what they're saying, driving the increases in fatal overdoses. Coronary heart disease was the second leading cause of death in the first year of the pandemic, accounting for 309, and this is within the homeless population, accounting for 309 deaths and an increase of almost 30% from the previous year, the report said. I would love to see, so coronary heart disease, I would love to see the age demographic. This report said Latino and Black people were the ones responsible for the increase in fatal overdoses. Coronary heart disease. What's the age category there? What is the age sampling there? Would love to know what that is, because oftentimes one of the ways people go out in the homeless encampments is from a heart attack or a stroke. And that's because they put so much pressure on their heart, which wasn't strong already because of their lifestyle. And you add, little too much of the fentanyl, boom, done, game over. But what's interesting is it's not from coronavirus. Didn't Just makes you really wonder, doesn't it? What's the dealio with that? Homeless encampment impacted more during the coronavirus from fentanyl, its cause of death, versus the actual disease that we were told day in and day out for what, a couple of years there? That, oh my word, you better watch out for it. You better mask up. You better wash your hands 100 times. Stay home. Don't go to school. Do everything remote. And yet it didn't impact a segment of the population that just flat out wasn't able to do that. They just didn't keep, they weren't within the constraints of what we were told by the CDC and everybody else that this is how you're going to survive. This is how you're going to make it. And instead they get taken out by ODs and fentanyl. Weird. Yeah. That one has always really made me think, okay, we're not getting the true story here somewhere. What is the deal? I'd like to know. Will we ever know? Probably not. Maybe people out there know. Maybe it'll come out, hey, here's what happened there. But I think it's all kind of part and parcel of a big package we were sold that maybe wasn't as, didn't have as much full disclosure as possibly could have. I don't know. Crazy stuff, right, though. Almost more susceptible to ODs than coronavirus. That doesn't seem possible, and yet that's what it was. I don't know. If I see the storyline more, I will let you know. But it's always been one of those things to me. It's like, that doesn't make a lot of sense. It's just not reasonable, is it? And I think that's part of my problem. It just doesn't feel right, doesn't seem reasonable. What's the deal? If you know, let me know. We'll catch up soon. Talk then. Bye for now.